All right, back to our conversation with the Chief Medical Officer, Marty Brueggemann of Virginia Mason Memorial. I asked him about Astria. Are you guys shipping patients over there? If I come in with a spleen thing and I don't have COVID, do you ship me right over to Astria? A lot of people think that's what's happening over there. Rather interesting response on what are we doing with that hospital as far as Virginia Mason Memorial is concerned.
Most people are aware now that Astria is going to be used as what's called a field hospital. That is part of a regional disaster management response. And so it's not just for Yakima, it's really for essentially all of eastern Washington. In terms of exactly how that facility will be used is still a little unclear, but we certainly welcome anything that gives the region additional capacity. And I think we're just kind of waiting to hear what the details are in terms of what they may or may not do. Again, we have no part in planning or staffing Astria. That is being done with a kind of a national disaster response plan. We certainly are in communication with them and will partner in any ways we can with them, but we are really inwardly focused to make sure that Virginia Mason Memorial is ready for Yakima, which is our primary responsibility.
Anything that you want to say particularly to the Yakima Valley in terms of words of warning, words of encouragement? We know it sounds like you guys have been really preparing well for this. You've been at it a long time. You have to think of every sort of potential thing that could come up. What do you want the Yakima Valley to know here as we head into what others have called this big week, and whether it manifests itself here or not?
Don't let your guard down. We reached out to the community 2-3 weeks ago. We were concerned at that time as we went around Yakima that we were not seeing people honoring the physical distancing, and we were very concerned with what that was going to mean for our community and our hospital. Since that time, the county has issued a stay-at-home order, and the next day the governor followed up with a stay-at-home order. And I can definitely say as you drive around now, you see people doing a better job. Although I still go some places and see places where maybe it's not being followed quite as closely as I'd like. This is a long haul. It's not something you can do for a couple of weeks and everything's good. I will say that I think we're seeing, hopefully, some benefits from that physical distancing. But if people let their guard down, they start to think that we've flattened the curve, as everyone likes to say, and that we're kind of over the hump, and they kind of come out and start interacting with each other, we will see another spike. And we've seen that with other epidemics or pandemics over the years where that's happened. So we really need people to just continue to honor, the physical distancing. Don't let your guard down. Just please stay at home as much as you can.
Have we had any cases yet where people had it, seem to get over it, and have caught it again? We've seen that occur in Japan and some other places, that you can get a second whack at this thing?
Yeah, that's kind of going to be the next piece of figuring this whole thing out, is when we get past this initial phase to see what is the risk of reinfection. I don't think we have a good understanding of that at this point. So I guess we'll just have to wait and see what science is able to tell us when we kind of unwind from this and we get a little more time under our belt. Certainly within Yakima, it's way too early to know.